Let's talk about how to control deadly bleeding. If deadly bleeding isn't controlled very quickly, there's a very good chance the person won't survive. Luckily, getting even a severe bleed under control can happen very fast if we take the right steps. A deadly bleed is always a 911 call. We can remember the steps to control deadly bleeding with the acronym REDDT, R-E-D-D-T. R is for rest. First, get the person into a comfortable resting position and try to encourage them to be calm. Lying down is best if the bleeding is severe. This can help to lower their heart rate and blood pressure and prevent a dangerous fall if they become unresponsive. E is for expose. Expose the wound. If there's clothing that makes it difficult to tell exactly where the blood is coming from, get it out of the way. Clothing can also wick blood from underneath bandages, making our treatment less effective. Loose clothing can be moved aside. It may be easier and less painful to cut the clothing. Any good first aid kit should have scissors for this. D is for direct pressure. Apply something clean and absorbent directly over the wound. Focused pressure is best, so folding up wide dressings may work better depending on the cut. Sterile gauze would be the best option for this, but if there's no first aid kit immediately available and the bleed is severe enough, find the cleanest absorbent material available. Deep cuts are susceptible to severe infection, so if the bleed is not life-threatening, it may be better to wait for a first aid kit. Once the dressings are in place, cover them by wrapping with a tight bandage. A tensor bandage, Velcro zap straps, or quick wrap is best. A bandage can be made of something stretchy and strong if no first aid kit is available. Make sure that you tuck in any dressings that stick out from underneath the wrap. This will prevent wicking and help slow the bleed. The next D is for even more direct pressure. If the blood soaks through the bandage past the point of minor spotting, apply another layer of dressings and bandage it the same way. T is for tourniquet. If none of this works, thankfully it usually will, and it's on a limb, then we will attach a tourniquet to stop the flow of blood to the wound. A commercial tourniquet is best. If one is not available, not all first aid kits have tourniquets, then it can be improvised with something long and strong. A tensor bandage or even roller gauze will work if wound tightly enough. The tourniquet should be placed about 5 centimeters above the wound. If the wound is just below the knee or elbow, put the tourniquet just above the joint. Explain to the person that it will be painful but safe and necessary. Tighten the tourniquet and watch the bandage closely. Stop tightening when the blood stops seeping into the bandage. Note the time and be sure to tell responders about the tourniquet. Tourniquets are safe unless they go unnoticed for a long time. Once a severe bleed is under control, make sure to use blankets to keep them warm and reassure them as best as you can. Even on a hot day, there's a good chance they'll feel cold because they're in severe shock.